my name is Ibarra.
Hi, my name is Charles.
For this summer, we worked in the lab that studies pulmonary hypertension, or PH. It's overseen by Dr. Young. The last main question is, what are the main mechanisms that lead to the progression of pulmonary hypertension?
Pulmonary hypertension is an incurable cardiovascular disease. If left untreated, it will lead to death. This disease is characterized by high blood pressure in the lungs and heart, causing the blood not to move freely in the pulmonary arteries, stressing the heart, resulting in heart failure. This does not allow the body to get the oxygen it needs. Symptoms consist of shortness of breath, fatigue, and body swelling.
It's unknown how many people get diagnosed with PH annually, but their symptoms get worse as time passes by. The life expectancy of a person that gets diagnosed with PH is 2 to 3 years, depending on the medication that they take. Currently, with the little information that we have, there's not enough to create an effective treatment or a cure.
A surplus of calcium leads to an influx of cells, making arterial walls thicker, increasing blood pressure. On the other hand, if calcium is too little, then the endothelial cells will malfunction, both leading to pulmonary hypertension.
The specific protein I worked with is STIM2. STIM2 is a calcium regulator that interacts with RI1, which is a calcium channel. This interaction allows an influx of calcium inside the cell. This only happens when there's not enough calcium. I ran multiple gels to see the concentration of STIM2 in different types of tissues. And I also ran more gels to compare the concentration of STIM2 in normal lung versus pH-induced lung.
The protein I work with is piezo 1 and 2. They are components of a mechanism that activates cation channels. They play a crucial role in pulmonary hypertension. Their activation allows calcium and sodium into the cell. A malfunction can lead to a surplus or insufficient amount of calcium, both leading to pulmonary hypertension. I run gels to see the genetic expression of piezo 1 and 2 in rat tissue. I'm working with 2 genes right now, GAPDH and piezo 2. I am comparing the expression of piezo 2 to GAPDH. We need to know more about STIM2 and piezo 1 and 2 to be closer to finding a reliable treatment. With better knowledge about these proteins, we can keep calcium levels normal in pulmonary arteries.
Now to the final questions. How can we manipulate STIM2 to control the calcium levels in the cell?
What role will piezo 1 and 2 play in the cure for pulmonary hypertension?